Thank you, Dr. Sunny. I'm going to speak on clinical research to validate and publish your innovations. These are my financial interests. I don't expect to have this impact in any of my talks here. So innovation and clinical research are not easy. Requires novelty to stand out because I think that's what the previous two speakers have already explained about. The two questions which comes to our mind when we want to do something to do with innovation, whether it's related to research or to publish. One is, can I? This is your angels talking to you, and demons in your mind, which is sometimes the predominant speakers, which keeps telling you why, because they don't need to do it. The most important thing is, I think Dr. Suven also mentioned about this, is there is most of the work has already been done because there are thousands and thousands of researchers who are already working on something. So questioning what if should be a very, very strong question. Me and Dr. Suven were co-chairing the Rangachari Awards yesterday. Little disappointment because out of the 19 papers, only 4 had, one is a winner here, only 4 had a research question which was worth looking from the second slide onwards. The rest of them had no research questions. Unfortunately, I mean, I'm very passionate about AIOS, the whole Rangachari stuff and all that. So I find it quite, I find it very, I sometimes get very angry when somebody has come so far without a research question. So I feel research question is the most important thing because that's the question which we answer. Sometimes the research questions can be extremely crazy because that's the fear I think we have. 99% of our research questions get shot down because your colleague who's sitting next to you who has no idea about it just says that it's too crazy and you just people are going to laugh at it. Like for example, Dr. Pukrash's paper yesterday was finding a biomarker in urine for something in air, for the ARMD. So it looks completely crazy. So exactly what we did was we were looking at psychological factors in outcome of surgeries. It looks very crazy. These are all crazy ideas which you need to plug in because that's the area which is where there are lots of areas where we can try to publish. We had to mingle with people who don't speak the same language. That's what the winner yesterday was. That's what I keep saying, that if you keep talking to the same people, you'll get the same kind of run-over-the-mill work, and you will probably never reach anywhere. You can't patent it, you don't publish it. I think Dr. Honover sir must be getting lots of these papers, which is the same copy of, like for example, South Indian, 200 eyes of South Indian eyes, 200 eyes of East India, 200 eyes of something. That doesn't work anywhere because it's in India. If you are looking at two geographical population, African Americans versus Asian Caucasians, that is a different this is the different thing. I use this a lot in my presentation. I call it the drop the story because all of us have a predetermined idea about how things should be. And that's why it's very difficult today to publish a novel work because we don't want to come out of the story. We have somebody, it's written in the book, I'll go to exactly to do the same thing, maybe add a little bit more. My p-value is a little bit better than hers p-value, and that's it, that's how it is. So the story, dropping the story is the most important thing in your clinical research. There are different ways to do it. I'll not go too deep into it, the preclinical, the clinical, and the analysis part of it. I'll give you some example. When we had this curiosity, why some patients who have neuropathic pain are not responding. So we used to we started seeing a small trend that these patients were patients who had with severe vitamin B12 deficiency. So we Googled it at that point of time, not Google PubMed. There was nothing on vitamin B12 in the eye. And we started writing this report, and this was hypothesis. That was not clear, but fortunately we got a good reviewer. He explained he wanted to create a hypothesis and clearly write that there is an hypothesis because it's very difficult to test it on a case report. And this was the first case report on vitamin B12 and ocular neuropathic pain, which people said that vitamin B12 have known. This is the first entry into nutrition. So what was important is when you get a lead, that there is a nutritional deficiencies which has not been studied too much, you start working on this direction, these directions. For example, after this, we started looking at vitamin D in the eye, and these are all the papers, maybe around 20 papers on vitamin D and eye itself. And I'm not quoting the papers on ROP, Anand has worked, and some retina, but you can see how it started with just a clinical observation. This is very important. You start with clinical observation, give hypothesis, you'll be rejected if your hypothesis is not strong enough. For example, if you really look at this here, the hypothesis has to be really strong enough from your published work from different zones. It need not be ophthalmology. This is from brain, this is from muscular peripheral neuropathies. We use all kinds of concept to come to the eye and build it. That's very important. And then the vitamin B12, vitamin D happened, and you can see that finally, after say 8 years of working on that project, we came out with this paper in IOVS as it's one of the largest vitamin D related work on that subject. So that means starting with the case report 7-8 years back, kept jumping to 20 papers and keep publishing on that zone. People will start realizing that you are kind of a small authority on it. And journals also know, I'm sure sir would know that he will also see if somebody has published on something which is unique, he will know that that person, if you PubMed him and you know that his papers are all on that easy. This paper completely, that's why there's a lot of my ex-fellows and colleagues who started with me 8 years back. That's something which is important. Just because somebody does not work with you at that point of time, you have to acknowledge somebody who worked with me 8 years back, somebody who worked with me 9 years. So I keep a documentation of who started that work, and irrespective of where they are, I keep entering them. And the first author is not even me, it would be somebody else. So what I'm trying to say is that give equal representation to everybody who's worked in your journey of some papers. So you have to be very, very good with this. This is for sir, and we have to have mercy on when we publish papers, something to do with biology, because we cannot get statistical significance. Biology is very difficult. Dr. Pukraj's paper also, it's a trend, but you can't get a significance. I know it's difficult for journals to accept something where is a trend, but that's how biology is, and that is where I think we are going to have any issues. How much time do I have? Okay, I'll just give you some papers which were submitted yesterday for the AIOS. Sometimes when you submit this paper, these are too early phase, but if you keep working, you'll see something like that what I just showed. Dr. Gairek worked on AI. Why AI is important? This is what the research question is. Can AI help in predicting keratoconus? This is his first slide. I'm just taking his slides. And look at the conclusion. And this is the methodology, how AI is worked on the corneal diseases. And he looked at the complete new parameters. This is what is the most important thing when you are publishing today. What was known in literature, what does this study add? So at one shot, you know that this study adds a new trend, a new classification, a new keratometry which can combine. So that's it. That's how it is. And no journal is going to take this off if you're not going to publish this. The second paper on unusual bacteria. That means what was a research question asked by her? We all know about this. If normally the trend is that we all start studying the same thing because it's easy. But what was studied is, can bacteria be driving force? Because in the era of coronavirus and microbiome, so she did a genetic genomic sequencing, and you find, and this is what was known, and what does this study add? Adds that it is a completely new microbiome which could be driving. So how does it work? This microbiome can be titrated tomorrow. Point of care diagnostic is something similar to Dr. Pukraj. This is a kit which looks at how does it work, how does the kit work. It can help to titrate what drops you're going to use. These are all some questions, and what is the process? I mean, this is very important when you build a kit. Where are we now? We are here now. What is the next step? Sensitivity, commercial, and lab production. So every single thing has to be by a flow. If you don't have a flow, what happens is we don't know where it is. Somebody comes and says, I'm going to do this in the lab. He may be just here. We think that is already coming to the clinic. So if you don't put the block where we are and the timeline, this works. And I mean, sometimes, I mean, these papers were severely criticized also in this AIOS, and none of them reached anywhere, not even the first step they won, because they think that this is not necessary to a country. I mean, that's what I said. You know, sometimes these ideas look crazy, but you need it. They said microbiome does not cause anything, but if you just go out of ophthalmology, 80% of the disease in other than ophthalmologists believe that microbiome runs your body. The finally, what really drives is a constant curiosity, the inner fear, the demons. Like I keep telling my fellows, all these papers did not go through anywhere. So I said that if you feel that you are worthless, they'll not work, because somewhere it will be respected. And strong research methodology is important. Like I said, exactly the flow, the research question and what it's going to lead. Collect and store everything possible. That's your biomarkers work. You have to work with people who are not speaking the same language like we all do in this room. That's not the comfort zone. I work with Anand. The kit, he has helped tremendously in working on the kit, and very fortunate that he's been part of our journey with both the Remedio and fundus camera and this one. And please collaborate, and like Suven said, whatever ideas you want, you decide whether you want to commercialize it or you want to publish it. If you want to commercialize it, patent it, look at the commercial angle. Otherwise, just work on the science like we're doing today. Thank you.